Hello, my name is Chelsea Hines, and I am a registered nurse and Master's of Nursing student at Athabasca University. Today I will be speaking with nursing theorist Patricia Benner on her novice to expert model and asking questions related to my field as a nursing instructor. Novice to expert model was first applied to nursing by Patricia Benner in 1982. As described by Patricia Benner herself in the American Journal of Nursing, 1982, this theory utilizes the Dreyfus model of skill acquisition and applies it to nursing. There are 5 levels of proficiency, and based on Benner's model, nurses will move through each level based upon experience. The 5 levels of proficiency are novice, advanced beginner, competent, proficient, and expert. According to Gobbett and Cassie, 2008, within the novice stage, learners acquire knowledge through instruction. Learners at this stage do not understand specific subtleties of situations, and therefore performance can be limited. Within the advanced beginner stage, after some experience, learners are able to limitedly apply this knowledge to new situations, and attributes begin to depend on the situation. Within the competent stage, prioritization begins, and learners understand hierarchy and care planning. Within this stage, there is increased efficiency. Proficient stage, learners begin to understand situations intuitively, but do still require analytical thinking in choosing the best action. And finally, in the expert stage, the understanding of the task, as well as the understanding of what to do next, is effortless and intuitive. Experts are seen to act naturally in situations and do not rely on reflective practice to guide reactions to situations. According to Benner, 1982, to move along in levels of proficiency, there are changes in 2 general aspects. One is the movement from dependence on abstract concepts to the use of concrete lived experiences, and the other is a change in understanding of situations as a whole, rather than small, equally important pieces. Patricia, it is a pleasure to speak with you today. I am a nursing instructor within the Bachelor of Science of Nursing, as well as the Practical Nurse program at a rural post-secondary institution. I was first introduced to your work in my own nursing school, and since beginning to work with nursing students, I've developed a great respect and often utilize your model in my everyday practice. I would like to ask you a few questions relating to your model to help me to gain a better understanding of situations that apply to my practice. Question 1. In a rural area, given that we have limitations on patient acuity, as well as available technology, resources, and staff, do you feel that student nurses are at a disadvantage of progressing to clinical expertise? How can we best foster experiential learning in these environments to ensure novice to expert transition? Question 2. In larger centers, clinical time can sometimes be made up if a student cannot attend clinical. However, given the constraints of our clinical partners, as well as competition among other healthcare professions for clinical placements, this is often not possible within our programs. What suggestions do you have for ensuring knowledge progression through your model if a student misses clinical time? Do you feel that simulation can replace clinical in these situations and still allow for experience to be gained similarly to if it were gained in a clinical setting? Question 3. Given that our clinical sites have limited preceptors available, and sometimes the preceptors are still very much in the earlier stages of your model as they are recent graduates, how can we ensure appropriate knowledge development and clinical expertise is provided to our students to ensure maximum success in these situations? Question 4. In our rural area, fostering community relationships is extremely important to our nursing curriculum. We often rely on the community to support our students and assist with achieving clinical expertise. How can your model be adapted to incorporate the importance of community-centered holistic nursing care? And lastly, question 5. Given the leadership responsibilities rural nurses often encounter, sometimes as early as 6 months to 1 year into their career, how can we best incorporate leadership using the novice to expert model of clinical expertise into our nursing curriculum? Thank you for your time, Patricia. I am grateful for your knowledge and expertise on this subject, and will utilize your responses in my practice and instruction going forward.